So it's live now.
Yes.
So hello everyone. I'm Dr. Kirti Suta from Dr. Makkar's Diabetes and Obesity Center. In this series of FAQs, we will be talking about hypertension. Hypertension and related complications till date remain a major health burden. There are a lot of factors which predisposes an individual to high BP. Managing high BP is an art which involves lifestyle intervention, medication, dietary modifications. And there are a lot of questions which come to our mind when we come across this word hypertension. Whether it can be cured or not, what to eat, what not, how much to exercise, which type of exercise, and so many. Hypertension is also known as a silent killer. And we have Dr. Makkar with us to give answers to all these questions. Good afternoon, sir.
Good afternoon, Dr. Kirti. Good afternoon, all the viewers on the other side of screen.
So high BP usually develops over time. Usually it has no warning signs and symptoms. And monitoring is the only tool to detect it. But there are plenty of questions in our mind which we want to know from you. Shall I start, sir?
Sure.
So what is hypertension?
So hypertension basically is, it's a term used to define high blood pressure. One common problem or misnomer is that people use the word hypertension for high levels of stress or tension, they have in mind. So actually that is wrong. Hypertension means high blood pressure. So that brings the question, what is the normal blood pressure then? And there are a lot of issues related to normal blood pressure or understanding of normal blood pressure also. And, it is not, I would say, wrong also, because these notions have been there since ages. And in fact, I think about a century back, more, maybe less, during Second World War, the American president, I think Roosevelt was there. So his blood pressure was 200, 250 or 270 and 200. And his physician considered that blood pressure normal because he was handling so many things. So people with high stress jobs and, high responsibility positions, they were supposed to have high blood pressure to deal with those positions. And people who were not having high stress jobs were not supposed to have high blood pressure. So if somebody's blood pressure was high, it was considered normal because now this person is handling that kind of position. And he had sudden death after that. And after that, a lot of things started changing and observational studies started coming up. And the Framingham was one of the largest studies where we started, defining blood pressure. So now it is very clear that normal blood pressure for an individual has to be less than 130 by 80. If it is more than 130 by 80, up to 140 by 90, it is considered high normal. And if it persists in this range also, person needs to follow lifestyle interventions. And if it is not able to, go down below 130 by 80 with lifestyle changes, you have to consider medication for these people also. There are studies which have clearly shown that if your blood pressure goes above 115 by 75, every 20 by 10 increase in blood pressure increases the risk of cardiovascular complications by 2 times. It doubles the risk of complications relating to heart, brain, and so on. So having a blood pressure in the normal range that is less than by 130 by 80 is important, and anything above that is considered hypertension.
So if we talk precisely about what is the normal BP number,
it should be less than 130 by 80. Now again, there comes an issue of age, so up to the age of 75 or so, it is considered normal. Above that age, you can have some people who have increase in only systolic blood pressure. So, but up to that age, 130 by 80 is to be considered normal blood pressure.
next question to you is, does hypertension or high BP produces any signs and symptoms?
So most of the people don't have any signs or symptoms. It is a silent disease. That is why it is considered a silent killer also, because it can lead to sudden strokes or paralytic attacks, sudden death because of the bleed in brain or in some vital organs, and it can lead to heart attacks or damage to the heart directly. So it is considered silent killer, and it's a silent disease for most of the patients. Some patients do report, mild headache or heavy headedness, but usually a person cannot, say that the symptom is related to high blood pressure. More often than not, what happens is the person is having headache and will have a high blood pressure because of headache. So actually, any stressful situation, any illness which is causing pain or something, can actually lead to increase in blood pressure. And that is why what people will correlate headache to the blood pressure, but it may be other side. The headache is causing increase in blood pressure, which is transitory. So it is very important to measure blood pressure once the person is rested and has not consumed any, has not smoked, not consumed any food for at least half an hour or 1 hour. Then only you check normal blood pressure. In a stress state, person's blood pressure will go up.
So that means monitoring is the only tool to detect hypertension.
Yes, regular checkups, and if somebody is having high blood pressure, then regular monitoring at home is also important.
My next question to you is, what are the risks associated if you have high blood pressure?
So high blood pressure can basically, what is the blood pressure? Why you have pressure in the arteries? Because heart is pumping blood at certain pressure, for which is important to drive that blood into various organs and tissues, right? Because every organ, every tissue needs blood, and blood is the source of oxygen and nutrients to various tissues. Now, to make it reach to the farthest parts of the tissues or body, heart has to pump it at a certain pressure. Now, once this pressure is high, it will start damaging the blood vessels, very vessels that it is flowing in. And then there are some organs where the damage will be higher. So heart is directly related to blood pressure because it is involved in, if the pressure is high, heart has to pump more. So heart failure chances or heart attack chances go on increasing. Damage to blood vessels leads to atherosclerosis, or the narrowing of blood vessels or stiffening of blood vessels, which can lead to damage to various organs. The common sites of damage are eye. One can have acute high blood pressure can lead to bleeding in the eyes. We commonly see people coming with bleeding from nose and relating it to blood pressure, but that may be due to other reasons also, but it may be due to blood pressure. Then it causes on long-term basis damage to kidneys, damage to eyes. Retinopathy can be there. It can lead to damage to heart. It can lead to heart attacks. Can lead to strokes. So many complications can be there because of blood pressure, and it can be life-threatening. And there is an increase in mortality if you have blood pressure.
So that means if left untreated, blood pressure can damage important major organs
And increase the risk of sudden death
of the body.
Yeah.
Right, sir. But sir, the good news is if we manage hypertension in the right time, we can prevent the complications, right?
Yes.
And here comes the role of the patient, doctor, and the family members.
Yes.
So how do I know I have high BP?
So only way of knowing that you have a normal or high blood pressure is to keep checking it regularly.
Any recommendations for it, sir?
So recommendations are, earlier we used to think, that getting it checked in a clinic is sufficient. Now there are different components of definition of blood pressure. So you have to see what is the blood pressure in clinic setting. And at least two readings, which are at least 24 hours apart, of more than 140/90 are considered as hypertension. More than 135/85 are considered as high normal. Home monitoring of blood pressure at least 2 readings of more than 130/80 are to be, documented to have high blood pressure. Then there is something called loss of nocturnal dipping. What happens is a normal individual, once person is sleeping, there is a drop of blood pressure which is more than 10 to 20 millimeters of mercury. So if this is less than 10 millimeters of mercury, it is loss of nocturnal dipping, which is again, one of the earliest things that happens in high blood pressure. And studies have shown that loss of nocturnal dipping is also risk predictor for various complications. So you have to focus on, what is happening in clinic setting, what is happening at home, and what is happening during night. So if somebody has, say, 140/90 or more than that at 2 settings in clinic, you have clear-cut high blood pressure. At same thing is, some people have masked hypertension. In clinic, you are seeing a blood pressure of 130/80, but person comes with the readings done at home and they are all above 130/80. So it is a masked hypertension. We are not able to see it in clinics, but at home person is having high blood pressure. Similarly, there is, nocturnal hypertension. During night, there is non-dipping, or there may be reverse, dipping, what is called. So there is, instead of dipping, there is a rise in blood pressure. And then what is the overall load of blood pressure? That can be measured by using a 24 hours ambulatory blood pressure monitoring. Now we have, technology which is advanced. So one can be applied a ambulatory blood pressure monitor, which keeps monitoring blood pressure every 20 to 30 minutes during day and every hour during night. Based on those readings, you can see what is the total blood pressure load over 24 hours period. And based on that also, you can see whether the person needs to be treated or not. But the commonest way of diagnosing is that if you have clinic blood pressure readings of more than 140/90 at least twice, and home blood pressure monitoring readings of 130/80 consistently, then you can easily diagnose blood pressure or hypertension.
So my next question to you is, what can we do to prevent or manage high blood pressures?
Okay, so there comes the various risk factors associated with which can cause blood pressure. So there are certain things which can be done, but not everything is in one individual's control, because there is something like genetic predisposition, there are epigenetic factors, environmental factors which will lead to increase in blood pressure also. But there are certain predictors which are there. So if you have overweight or obesity, the risk of blood pressure goes up. Stressful personality is associated with high blood pressure. Consumption of certain drugs on regular basis can lead to blood pressure, especially steroids, long consumption of painkillers also can lead to increase in blood pressure. Then if somebody has diabetes or pre-diabetes or heart disease, the chances of getting blood pressure go up. Having kidney disease, chances of getting blood pressure go up. Having blood pressure, high blood pressure, chances of kidney disease will increase. So there are a lot of things which can increase the risk of blood pressure. So most important thing that one can do to prevent or reduce the risk of getting hypertension is to make sure that they are having a regular physical activity, and they are maintaining as normal body weight as possible. If they are overweight or obese, they must lose weight so that they don't get blood pressure early.
So this was about the prevention, but if I talk about managing blood pressure and exercise, what are the recommendations for exercise? How much to exercise? What type of exercise?
See, usually there is no contraindication for exercise unless somebody is doing very intensive weight training. I don't think there is any contraindication for exercise in high blood pressure patients. And for that matter, for maintaining good health, the recommended exercise is brisk walk or equivalent moderately vigorous physical activity, which can be cycling or swimming or aerobics or dance, so those kind of activities done about 45 minutes a day on daily basis, it's sufficient to maintain good health. Second important component is to reduce weight. So you have to focus on diet also. Person should not be consuming excess calories. Then there is a very strong association with increased intake of salt. So salt intake has to be moderated or reduced to make sure that you don't increase your risk of getting hypertension. But as for exercise is concerned, I don't think there is any major any contraindication as far as exercise is concerned for hypertensive patients. In fact, it is beneficial. It improves blood pressure, brings it lower.
So you were talking of genetic predisposition. So that means if I have high BP, my children will have high BP.
Chances are yes.
So that means
Their chances of it is not that they will have chances of getting blood pressure for the child who has a parental history of hypertension are higher than those children who do not have history of hypertension in family. So there is nothing absolute, but the risk goes up.
So what can we do to prevent high blood pressures from early of their life?
So first thing is, as I mentioned, to make sure that person does not gain weight. So maintaining normal body weight, that is something which one can focus on. So that involves, in any case, a regular physical activity and a healthy diet. If you are not taking these two things, chances are the weight gain will be there. And second thing is to decrease the intake of salt. These two are the important things which can help you in preventing development of high blood pressure.
So don't you think these kids, they eat a lot of junk, a lot of salt in their diet?
So that's
how
the
to
problem.
tackle with this problem?
That is what I'm saying. So one has to focus on healthy eating. You have to cut down the intake of salt. You have to cut down the intake of high calorie dense foods, so that you don't take excess calories and you don't take excess salt. The fat is again calorie dense food, so you have to reduce consumption of fat and maintain regular physical activity. If one can do this and make sure that person is not overweight or obese, then chances of getting blood pressure or hypertension will be significantly lower.
Basically, we need to be aware of high blood pressure. We need to have small changes right from the childhood itself in the diet and all these things.
Yes.
So what is the relation between obesity and hypertension?
Very strong correlation. Almost, the current data says that almost 70% of the high blood pressure or hypertension is because of obesity. So there is very strong correlation between obesity and development of hypertension. Obesity leads to multiple metabolic and pathophysiological changes in body, which leads to insulin resistance, increase in the factors that increase blood pressure, and decrease in the factors that actually improve blood vessel function. So directly and indirectly, it leads to increase in blood pressure in individuals who are overweight or obese. And other thing is, obesity also increases the risk of multiple other comorbidities which are associated with hypertension. So obesity per se can lead to increased risk of kidney disease, but gets further damaged by hypertension, or kidney disease can also lead to hypertension. Similarly, obesity increases risk of heart disease, and hypertension further causes damage at that level, so on. So there is a strong correlation between obesity and hypertension.
Again, sir, proving obesity is the mother of diseases.
Yes.
So you were talking about monitoring of blood pressure, at home monitoring, and the use of ABPM. What is the ideal way of monitoring blood pressure?
So ideally, we should look at blood pressure when we expect it to be high. We should not miss the peaks that happen. So one of these surges happens early in the morning. Because of the circadian rhythm, there is increase in the hormonal surge in the morning, which lead to increase in blood pressure. And so best time to measure at home is within 1 hour of waking up. And second time is before going to bed, or after dinner and before going off to sleep. These are two times which you can easily measure also. Daytime, you may not be able to measure going to office at work, but these 2 point of time, you should measure blood pressure regularly if you have high blood pressure. If you don't have high blood pressure, every time you have an opportunity to visit a physician for whatever reason, you should get your blood pressure checked, or at home maybe once in a month or once in 3 months also, if you keep checking, is fine. But if you have high blood pressure, you should check morning, evening, at least every second or third day if you are controlled. If you're not controlled, you should monitor regularly and be in touch with your doctor for change or upgradation or intensification of your treatment.
Do you recommend every house should have an apparatus at home?
I think so. These things have become more of a necessity now. To get a blood pressure checked, if somebody has to go to a physician, or for that matter, they will go to a chemist shop. First, you need time, you need convenience. It may not be feasible to do it conveniently, and it costs money every time. Blood pressure meters are not very expensive. Now, in Indian setting, everybody can afford a mobile phone. So practically, most of the people, I would say, can afford to buy a blood pressure meter and have it home. And for good thing is, it is not like glucometer that we advise people to use separate glucometers because of the contamination and other factors. Blood pressure monitor, one monitor is sufficient for the whole family. Anybody can keep checking anytime. So it's a good tool that one should have at home.
Another very important question which arises in the mind of patients is, can hypertension be cured of?
So as of now, we do not have any cure for hypertension. Second thing is, it is a disease which progressively kind of goes on increasing. With age, the blood pressure keeps on increasing slowly with age. Similarly, if somebody has high blood pressure, person may get controlled on one medication today. After few years, person will need add-on second medication. After some point of time, person may need 3 medications. In fact, most of the people require more than 2 or 3 medications to control blood pressure adequately. So it is very important to focus on lifestyle intervention, because lifestyle interventions give you a blood pressure reduction of 10 by 5 millimeters easily. And that is the amount of blood pressure reduction which is given by any good and pharmacological agent or a medicine. So if you are regularly following your lifestyle measures, then you actually are taking care of one medicine that will need to be added if you are not following lifestyle interventions. So it is very important to focus on lifestyle interventions and keep taking medications, making sure that your BP is less than 130 by 80 or 135 by 85, depending on what your doctor is telling. There are differences in thought, various guidelines, but most of the guidelines will agree that we should keep it less than 130 by 80. But there are studies which have shown that if it is 140 by 90, still it does not make any difference if you go further lower. There are studies which have shown that if you go lower, you will have benefit. So there, and then depends on whether person has heart disease, kidney disease, and so on. So many things are there which will decide what blood pressure you. But general rule, keep it less than 130 by 80 and make sure that you are taking adequate lifestyle measures and regular medication. One common thing, the person walks into your clinic and first thing they will tell, doc, I am willing to do anything, but don't give me more medication. They will say that give me least medication and rest everything I will take care of. So this is the usual, thing that patients will come and tell you. Now they need to be explained that it is not important that how many medications they are taking. What is more important is whether they are achieving the blood pressure goal or no. If their blood pressure is higher than the goal blood pressure, even by taking whatever medication they are taking, they are still at a higher risk. So it is very important to not to focus on the number of medications required, but to focus on the goal blood pressure. And we should try to achieve that, which is more important.
So here's the importance of combination pills, what I feel is. So talking about diet, how important is diet in the control or the management of high blood pressures?
So I mentioned earlier also that salt restriction is the main component that one has to focus on. So everybody who has high blood pressure, in fact, generally also, we don't need that much salt that we eat normally. So the general recommendation is that total salt intake should be around 2.5 grams per day. This includes the total salt which is mixed in vegetables, breads, whatever you are taking. And if you are taking less than that, then it is okay. So salt restriction is one of the major things, and you can reduce it by adding less salt to the vegetables that are cooked, adding no salt on the salads. We Indians have a typical system of having some chaat masala, some salt on all salad and all, even fruits. So we have to cut down that intake of salt. No add-on salt on the dining table. And whatever is there in the cooking should also be less salt. And we should avoid, salted snacks because they have a lot of salt that adds on to our dietary intake. That is one of the most important components. Second thing is we should cut down the intake of fat and calorie dense foods because that helps in keeping your weight on target and also reduces the risk of having lipid abnormalities, which is again one of the added risk factors with high blood pressure.
So avoiding the junks, basically, avoiding the processed foods, avoiding the bakery items, sir.
Everything that
Is
that
calorie
is
dense.
everything
Tasty.
that is tasty is to be avoided.
Right, sir. So now I would like you to tell us about alcohol intake, smoking, and all these things, and correlation with high blood pressure.
So smoking is something which is, it has not been proven to have any benefit whatsoever in any situation. So every single cigarette that you are smoking gives you some drawback. The least that you would, lose is some money on smoking. But if you are regularly smoking, it gives you a severe increase in your, oxidative stress in the body, which is one of the root causes of multiple problems or multiple diseases. Smoking is associated with almost all kinds of cancers. There is not a single cancer which is reduced in people who smoke. Every single cancer is increased. Smoking is associated with increased risk of heart disease, increased risk of, blocking of the arteries, atherosclerosis, which leads to damage to various other tissues in the body. So smoking is a major risk factor which has to go off totally for all patients. Now comes the issue of alcohol. Now, there are clear-cut studies that excess alcohol consumption is associated with high blood pressure. So people who are consuming high amounts of alcohol should certainly stop consuming high amounts of alcohol. Only moderate amount of alcohol is permissible or should be, continued. If somebody is taking higher amount, it is to be stopped or best avoided. What is moderate alcohol? Moderate alcohol intake is less than 60 ml for men and less than 45 ml for women on any given day, even if it is taken 7 days a week. That does not mean that you can take 180 ml on 2 days a week. So it is daily alcohol intake should not exceed 60 ml for men and 45 ml for women. And if it is regularly done also, there are some studies which have shown that this may be beneficial. But people who do not take alcohol, it is not to be recommended because alcohol has addiction potential, which has to be kept in mind. So in general, moderate alcohol intake is okay if somebody is regularly taking that amount of alcohol is not a big deal. More than this, certainly it has to be stopped or avoided.
Sir, any other point you would like to touch on?
Uh, I think we were talking about the cure and the medication. So there, I think we need to add certain points. One most important point is that people think that my blood pressure has become normal, so they will stop medication. So this is something which is very wrong notion or a myth. If you have high blood pressure, you have to continue on medication for rest of life. Now, in Indian setting, there are states where there is very high temperature during summers. During that time, because of the dehydration and because of various other factors during that summer, mild hypertension people may have normal blood pressure or may start going a little low. And some people might need a reduction on medication. That does not mean that they will manage with the reduced medication during winters also, or they will be able to stop medication. So they have to be regularly monitoring their blood pressure, and medicine has to continue for life. And they have to keep in mind that their medication requirement might go increasing with passing years, but hypertension is a disease which can be controlled but cannot be cured. And if you are taking the prescribed medications, and there are a lot of medications which have beneficial effects on heart, on kidneys, on eyes, and so on. And if you are regularly under treatment from a physician who is taking care of your blood pressure, who is uh, making sure that you are on the right kind of medications according to the management guidelines for high blood pressure, and that you are getting regular investigations every year to monitor damage to various organs or parameters that may be deranged with high blood pressure. That is the way to go forward. One should never try to stop treatment for high blood pressure, because as long as you are on treatment, you will remain controlled and you will be able to prevent damage because of hypertension and also all the complications related to hypertension. So one should not try to run away from medication and just try experimenting with others. The medication is an ongoing thing for rest of life.
So very important thing which I usually see in my practice is that people, I'm not against any pathies, but what I see is that people have more faith in other pathies instead of our allopathy. What's your take on this point?
See, there is no harm trying whatever you want to try. But the problem is, allopathy is the most developed medical science currently in the world. We have something called evidence-based medicine.
Yes,
That is
first is evidence.
what is allopathy is based on evidence-based medicine. So everything that we are talking or we are doing is based on large clinical trials which have assessed the benefit risk ratio of any therapy, right? The other, unfortunately, other fields of medicine like allopathy, homeopathy, or Ayurveda or Chinese medicine, so many things are not so developed, and they are not evidence based. They have anecdotal evidences showing that these things are helpful and they are used as treatments, but there is nothing like a standardization. Suppose you are taking something from Ayurveda. It is usually based on some herbal concoction or some herbal extract. Now, what we use in allopathy are single compounds, right? You know that suppose you are using, say, diuretic, chlorthalidone. You know that 6.25 milligram is going to give this much reduction in blood pressure in, say, 80% of the cases. It may be little more, little less, but this is the usual what we are expecting. Suppose you are making it 12.5 milligrams, this is what you are going to see. And you also know that if you increase it to, say, this dose, say 25 milligrams, there are going to be more side effects. So based on that, you know what is the therapeutic dose, what is the maximum effective dose that you are taking, and what is the toxic dose also. Because for that, everything you have done studies. those things are not there in most of the other sciences. So I think it is very important to focus on what we have in light of the best evidence, rather than trying to experiment and play with our disease or our own body system and end up with complications.
True, sir. So that brings to the end of session.
Thank you, Dr. Kirti, and
Thank you,
thank
sir.
you everyone for joining our session. Hope you are enjoying and you feel these sessions are providing you, good information to help you manage your own health conditions. And we hope that we are able to deliver again and again when we do these sessions. Hope to see you again during our next week, Thursday Facebook Live. Thank you.
Thank you, everyone.